Can bisphosphonates lower my osteoporosis fracture risk by 70%? Imagine a medication that could dramatically cut your chances of breaking a bone. That sounds promising, but when it comes to bisphosphonates and fracture risk reduction, the reality is more nuanced. Bisphosphonates are widely prescribed to treat osteoporosis, a condition where bones become fragile and more likely to fracture. They work by slowing down bone loss, helping to maintain or even increase bone density over time. But can they lower your fracture risk by 70%? Let's explore what the scientific evidence says. Studies involving large groups of people have shown that bisphosphonates do significantly reduce fracture risk, especially in postmenopausal women. For example, some research indicates that fracture rates can drop from around 37% before treatment to about 15% after taking bisphosphonates. While this is a notable decrease, it translates to roughly a 40 to 50% reduction, not 70%. Other studies and meta-analyses have reported that bisphosphonates reduce the overall risk of osteoporotic fractures by about 38%. They also show a reduction in vertebral fractures by about 45% and non-vertebral fractures, including hip and wrist, by approximately 27%. For hip fractures specifically, some guidelines suggest risk reductions in the range of 40 to 50% with medications like alendronate, risedronate, and zoledronic acid. Based on this data, achieving a 70% reduction in fracture risk with bisphosphonates is not supported by current evidence. The most reliable studies show that while these medications are effective, their impact falls within the 20 to 50% range. This is still very meaningful because even moderate risk reductions can prevent serious injuries and improve quality of life. However, it's important to understand that no medication can guarantee such a high level of risk reduction. Several factors influence how well bisphosphonates work for each person. The type of fracture matters. Vertebral fractures tend to show greater risk reduction than fractures of the hip or wrist. The length of time on treatment also plays a role. Benefits generally increase with longer use, but it usually takes at least a year of consistent therapy to see noticeable effects. People with very low bone density or previous fractures might experience more benefit in absolute terms, but the relative reduction remains within the same general range. Adherence to the prescribed medication schedule is crucial, as missing doses can lessen the effectiveness. Practical considerations include the fact that bisphosphonates are considered first-line treatments for osteoporosis because of their proven ability to lower fracture risk. They come in oral forms taken weekly or monthly, and intravenous versions administered annually. Like all medications, they can have side effects, such as stomach irritation or, rarely, atypical femur fractures. Deciding to start or continue bisphosphonate therapy should always involve a healthcare provider who can assess your individual risks and benefits. In summary, while bisphosphonates are effective at reducing fracture risk, they do not lower it by 70%. The best scientific evidence shows a reduction in the 20 to 50% range, depending on the fracture type and medication used. They are an important part of managing osteoporosis but work best when combined with other strategies like adequate calcium and vitamin D intake, regular weight-bearing exercise, and fall prevention. Always talk to your healthcare professional for personalized advice, as each person's situation is unique. Osteoporosis management is a comprehensive process, and your treatment plan should reflect your specific health needs.